Mr. President.
Senator from Louisiana.
Mr. President, I had the privilege today with Senator Collins to introduce a replacement bill for Obamacare. And if you will, it's been her experience as a insurance commissioner, mine as a physician caring for the uninsured and the underinsured. And let me also give due credit to Pete Sessions, who's over on the House side, who's introducing a very similar bill, to come up with something that we think works. And not just for people we represent, but for the entire country. And that is our goal. So I'd like to speak a little bit about the Patient Freedom Act of 2017. And our goal, if you will, I just tell my staff to imagine a woman who voted for Donald Trump, doesn't like Obamacare, but she's got breast cancer. And her coverage has a $6,000 deductible, but she has coverage. On the other hand, she wants to see something different. If we keep our efforts, if we just view our efforts through the prism of her care, then, Mr. President, I think we'll do right by the American people. And let me say something else. Our goal, again, is not to come up with a Republican plan. It is not to come up with an anti-Obamacare plan. Our goal is to come up with an American patient plan where whomever she is or he is, they can feel comfortable that we as a Senate are trying to do right by the American people. So let's go to first principles. First principles is we in the Republican Party think that if you like your insurance, you should be able to keep it. And I'll come to that later. President Obama got rightly criticized because he pledged that. Turns out it wasn't true. That's one of our first principles. We mean it. Secondly, we think that states should have the power, not the federal government. When you speak to Americans, they want their state capital to be the kind of principal force behind how their insurance is administered, not our nation's capital. So we return power to both the states and to patients. And lastly, I will say that we are truly reaching out to Democrats. One of the criticisms of Obamacare, it was rammed through on a partisan vote with hardly a consideration given of Republicans. Senator Collins and I are absolutely open to working with Democrats for this solution. So how do we begin? We first begin by repealing the Obamacare mandates and penalties. The American people do not like Washington telling them how to live their lives. So we take those mandates and penalties for both the individual and the employer, and we take them off. Secondly, we work to make health care truly affordable. We do this by giving states a choice to put in what we call the state alternative. I think we're going to begin calling it the better choice. And in the better choice, we would use tax credits that would go to those who are eligible, that would go into an account that would be, if the patient did nothing, she would have a health savings account which would be pre-funded. The money would go in, actually put money into the account, catastrophic coverage, and a pharmacy benefit. It's important to note that she would have the power over this account. If she wished, she could combine it with her family and these different tax credits, and they could buy a richer family policy. Or she could assign it to her employer as the employee's contribution for an employer-sponsored plan. If the family decided each of them to keep their own HSA account, and one of them got a terrible illness and they kind of went into the cash portion, they exhausted their health savings account, we would allow family members to donate their health savings account balance to each other to help cover that cash exposure. We do different things, but the goal is to give the patient the power. Now, we also, since we are going to these health savings accounts under the better choice model, that's okay, you can leave it here. In the better choice model, again, we give these tax credits that go into a health savings account. The individual can donate their own money or the employer can contribute theirs. Here are some of the options that they can do. But whichever option they have, we institute price transparency. That is to say that when the patient goes to have her blood test, she will know the cost of the blood test before she has it done, as opposed to finding out later. This came to mind this past Sunday. I had a friend in town who was in for the inauguration. She's a physician, and she went for a vitamin D level. When she goes for a vitamin D level, she gets the bill. It's $290. She calls up the hospital. She goes, I order these all the time. Am I really getting a $290 charge on each of these? Oh, yes, ma'am, that's what we bill patients. So she goes to different labs and she finds out what the cash price is for the panels of labs she typically orders. She has a patient come who's from out of town paying cash, and she says, pay me $38. It'll cover the labs. Here's the slip. Go to the lab. Patient pays $38, but goes to the wrong laboratory. She's from out of town, not quite sure where to go. She goes to the wrong laboratory. The bill she gets, which in one lab would be $38, in the other lab is $690. My physician friend calls the hospital, says, you got to be kidding, $690. They reduced it to $380. There is a tenfold difference in the cash price for labs. If the patient wanted known that, she probably would have paid more attention to the directions. But certainly if the price of the labs were posted when she went up, even if she went to the wrong place, she could have looked at the fee schedule and decided that she needed to go someplace else. One of my young men who works with me said, yeah, I get it, price transparency. Who would buy a car without knowing the price beforehand? It would be great for the car dealer, but really lousy for you. That's how we purchase health care now. It's great for the folks selling the service. It's pretty lousy for the person selling the cash, paying with cash. And by this, we think we begin to use market forces to reduce costs. By the way, this is not only about saving the patient money, which is very important, but there's also an example. John Fleming is a physician who until recently was a member of the House of Representatives. And he tells the story of how a woman who worked with him, their office went to health savings accounts, and she came up and she said, Dr. Fleming, I don't like these health savings accounts. Previously, I had a pharmacy benefit that paid for my inhaler, and now don't have the same pharmacy benefit. And he goes, well, and you're under their plan at least, the health savings account, you can use that to pay for your inhaler. And he walks away. 6 months later, she comes up to him, and he turns around as she walks away and says, oh, by the way, if you stop smoking, you wouldn't need an inhaler. And then he walks away. 6 months later, she comes up, Dr. Fleming, you were right. He goes, I'm sorry, what was I didn't remember the conversation. And he turns around, she goes, remember when you told me if I stopped smoking, I wouldn't need an inhaler? I stopped smoking and I don't need an inhaler. So what this does, it activates the patient. It gets her or him engaged in their health care. And between that, not only do we protect the patient's pocketbook, but we also do something positive for their health care. Now, under our plan, can we go back to the one we had previously? Let me also point this out. We think most states will go for the better choice. It is possible, though, a state will reject everything. We don't want Medicaid expansion dollars. We don't want any extra help for those who are lower income, and we would give states that choice. This is not Washington, D.C. forcing something on people. Let me also point out something else. Republicans believe if you like your health care, you can keep it. Your health insurance, you can keep it, and we mean it. If a state decided they wished to stay in Obamacare, I think it's a terrible decision. But this legislation would allow a state to do so. I was so disappointed. I saw that the minority leader, Mr. Schumer, criticized our bill, said things that weren't true, fake news, if you will, and that we didn't cover pre-existing conditions. We do. That the deductibles and copays would be too high. That's not true. But what's striking is that he hasn't read our legislation yet. This is what's wrong with Washington, D.C. Here we have something which in good faith would allow New York to stay in Obamacare if the people of New York decided they wish to, but we can look at double and even triple-digit premium increases in other states, and without reading our bill, other states are going to be condemned to these double and triple-digit premium increases because folks don't want to consider something different. This is not a Republican plan. It is not a Democratic plan. We want it to be an American plan where states can decide the best system for their state, and if it's working for New York, they can stay in New York. It's not working for Louisiana, and so our state would go with the better choice, I'm confident. But that said, please don't criticize the plan before you even look at it. And please allow those in the Democratic side who are down to one insurance company on their exchanges with double-digit premium increases to at least consider an option that would be good for their state. Now, folks say, well, hey, you don't have a mandate. We don't think Washington, D.C. should be telling people how to live their lives. So how do we, under our better choice, get folks to get the kind of big insurance pool without a mandate? We give states the option to do what we call automatic enrollment. If someone is eligible, they would be enrolled. The tax credit they receive would be adequate for their premium. They would never have to put anything out of pocket to have this health savings account, high deductible health plan and pharmacy benefit that would be covered with the tax credit that they received. And by doing so, all these young males who haven't signed up for Obamacare because they're paying too much would actually be enrolled in an insurance plan. And now, for those who get ill or have chronic conditions, you're spreading the cost of their expensive illness over the many healthy and not just over the few sick. It restores the law of big numbers. We had an insurance plan model this, and they said they think just by doing our method of enrollment, it would lower premiums by 20%. That's without an individual mandate. By the way, think of the folks that will never sign up for an Obamacare exchange policy. The mentally ill person living beneath a bridge. He's not going to go to a public library. If he has a W-2 form, he doesn't know where it is, and sign up for a 16-page online form to sign up for Obamacare. Under our policy, he could be automatically enrolled. And so if he goes to the urgent care center with a cellulitis, he has coverage. If something terrible happens, he's hit by a car, goes to the emergency room and is admitted to the hospital, society is protected from major expenses. And if he gets his life together enough, he has a pharmacy benefit to provide him those antipsychotics. So we actually think we will increase the number who truly need health care, the number of those who are covered. Let me finish up by speaking about our timeline. We would hope over this next year that Republicans and Democrats can come together. I understand Democrats will not vote for a reconciliation bill that begins the repeal process of Obamacare, but that almost certainly will pass. What we would hope is that sometime within this year, Democrats who live in states with only one insurance company on their exchanges, in which premiums are increasing by double, maybe even at that time in their states, triple digits, would come together to vote with us to give their state an option for our better choice. So we would pass that legislation in 2017, giving their state legislatures and governors the option to choose this pathway in 2018. In 2019, the states would implement their option of choice, and by 2020, it's all been done. That is our hope. Folks say Senator Collins and I are naive, that the Senate cannot overcome its partisanship, that inevitably it'll be so partisan, people without reading bills will criticize our legislation, saying things about it which are not true. And I go back to where I started. That woman didn't go to college, working hard, voted for Trump, doesn't like Obamacare, but has breast cancer. She needs coverage, and she wants something done for her. We want to give her the power. We want to give her that coverage. And my goal is that when this finishes, as she goes from cancer to health, the only thing that she knows about her coverage is that decisions about her health care are made in her state capital and around her kitchen table, and that as her breast cancer is treated, her health coverage improves. That's our goal. It is not a Democratic plan or Republican plan. It is not a partisan plan. It is a plan for her. That is our goal. And now I yield.
Madam President. The Senator from Maine.
Thank you, Madam President. First, let me commend the senator from Louisiana for his extraordinary work on this bill. It has been a great pleasure to work so closely with him as we have made a genuine effort to put together a bill that would be a reasonable replacement for Obamacare that would help to bring people together. And I just want to commend him for his expertise. As a physician, Senator Cassidy brings an important perspective to this debate, particularly since he has practiced for so many years in hospitals in Louisiana that serve the uninsured. So I want to personally thank him for the privilege of working to craft this bill together. Madam President, there has been much debate recently on the best approach to replacing and reforming the Affordable Care Act. Considerable confusion and anxiety exists about the current status of the law and about the future of health care in our country. What is often overlooked in this discussion, however, is that while the ACA provides valuable assistance for some people who were previously uninsured, the system created by the law is under tremendous financial strain. Obamacare exchanges are on the verge of collapse in many states. The reality is that significant changes must be made. Doing nothing cannot be an option. I am therefore both surprised and disappointed by the remarks of the Democratic leader to the press and on the floor today about the genuine effort that Senator Cassidy and I have put forward in introducing the Patient Freedom Act. First of all, let me point out that the Democratic leader could not possibly have read our bill since we hadn't introduced it yet. And it is evident that he has misunderstood many of its provisions. For example, in a press statement, he said that we gutted the pre-existing condition protections that we strongly support and that are codified in our bill in Section 101B. That's Section 101B. It ensures that insurers cannot discriminate against individuals with pre-existing conditions who pay their premiums. I guess what disappoints me most, Madam President, is that the Democratic leader's response really represents what's wrong with Washington, D.C. The American people want us to come together. They want Democrats and Republicans to work as a team to solve the problems facing our nation. If we are going to have a leader on the other side of the aisle denounce to the press and come to the Senate floor to criticize a bill that has not even been introduced yet, where are we? I really hope that this is an aberration and that we can work together and that the compromises that we put in the bill are recognized as a good faith effort to bring both sides of the aisle together in the interests of the American people and in providing access to affordable health care. That's our goal. We're not saying our bill is perfect. We are open to refinements, but we have made a good faith effort. And to hear it described inaccurately and as other than a genuine effort to solve a problem truly disappoints me. The fact is the ACA has been in effect for years, yet nearly 30 million Americans still do not have health insurance coverage. Many of those who do not have coverage through the ACA, who do have coverage through the ACA exchanges, are experiencing large spikes in premiums, deductibles, and copays, increasing costs to consumers and taxpayers alike. Contrary to the predictions made by the early supporters of the ACA, premiums are increasing in nearly every state, with an average increase of 25% nationally. Now, in New York State, the average increase on the exchange is 16.6%. I don't know, perhaps the Democratic leader thinks that is an acceptable rate of increase. It strikes me as pretty high. And the situation, even though it's below the national average, is still in the double digits. The situation is even more dire in some states like Arizona, where premiums have increased by 116%. And in many counties throughout our country, there is only one or two health insurers offering plans on the exchanges, severely limiting consumer choice. In my state of Maine, premiums for the individual market for 2017 have soared by 22% on average, and plan options have become more limited. Now, subsidies do cushion the blow for those consumers who are eligible for them, but others have had to shoulder the full increase. And of course, taxpayers have borne a greater burden. Moreover, individuals and families with incomes exceeding 250% of the poverty rate are not shielded from the dramatic increases in deductibles and copays. That is important to remember. The premium subsidy goes up to incomes up to 400% of the poverty rate. It then, by the way, drops off the cliff, and you're eligible for no subsidy whatsoever. There's no orderly phase out. But for help with copays and deductibles under the Affordable Care Act, the threshold is 250% of the poverty rate. So these huge premium spikes and increases in deductibles and larger copays are having an effect on families and individuals who are by no means wealthy all over this nation. Many with coverage under the ACA are also facing increasingly narrow networks, which means that they may find that their preferred doctors are not in their networks. This can be particularly difficult for rural states that may have few specialists and whose citizens rely on major medical centers in nearby states. If patients want to continue to see these doctors, they can be faced with enormous costs that are not covered by their ACA insurance. As one Mainer put it, President Obama said, "I could keep my doctor," and the insurance company says, "I can't." The co-ops created under the ACA to help provide health insurance coverage have been failing at an alarming rate. In fact, only 5 of the 23 remain operational. It is also important to carefully consider the effects that ObamaCare's Medicare cuts have had on providers like rural hospitals and home health agencies, many of whom are struggling. In some Prices are skyrocketing, coverage is narrowing, and the individual market is likely in a death spiral if Congress fails to act. Madam President, I know that many members of this chamber share the goal of expanding access to affordable health care. Over the years, I've collaborated with colleagues on both sides of the aisle on a number of initiatives. And today, I'm pleased to join my colleague, Senator and Dr. Bill Cassidy, in introducing the Patient Freedom Act of 2017 to help ensure that Americans have access to affordable health care that improves choices and helps to restrain costs. Let me emphasize again that our bill is a work in progress. It is not perfect. However, what it does, and it's virtually unique in this regard, in this chamber, is it puts specific proposals on the table as we seek to craft bills to repair and improve the Affordable Care Act. Other legislation being discussed, such as those designed to help small businesses pool risks so that they can better afford to provide insurance to their employees, also deserve consideration. Let's get a lot of ideas on the table, but you have to start. And we have been willing to step forward and propose a specific bill. And to be criticized for that by the Democratic leader is just so disappointing, particularly since the leader is well aware that I work across the aisle all the time to try to find solutions for our country. The Patient Freedom Act is built on the premise that giving people more choices is superior to the one-size-fits-all approach that defined the Affordable Care Act. We recognize that what works best for the people in Maine or New Hampshire may not be right for the people in New York or California. Our bill respects those differences by giving states options to choose the path that works best for their citizens. Now, one of the options, Madam President, would allow a state to choose to continue operating insurance markets pursuant to all the rules of the Affordable Care Act. So if New York State wants to keep with the status quo, despite the 16.6% increase on average in the premiums for the individual market, New York State can make that choice. If a state chooses to remain covered by the ACA, exchange policies will continue to be eligible for cost-sharing subsidies and advanced premium tax credits, and the insurance markets will still be subject to ACA requirements. The individual mandate and the employer mandate will also remain in place for that state. Medicaid expansion states will continue to receive federal funding. So if a state's happy with the status quo, with spiraling costs, with limited choices, with a market that is broken, fine, keep the ACA. In some states, maybe it's working well. States should have that option, and they would under the Cassidy-Collins bill. More appealing to many states, however, would be what we call the better choice option in the Patient Freedom Act that would allow a state to waive many of the requirements of the ACA except for vital consumer protections and still receive federal funding to help its residents purchase affordable health insurance. Senator Cassidy has explained how it will work, so I won't go through that all again. Let me just say that eligible individuals in states selecting this option would receive federal funding deposited into their Roth health savings accounts. The aggregate funding for these per beneficiary deposits would be determined based on the total amount of funding that the federal government would have provided in the form of ACA subsidies in each state, plus any funding each state would have received had it chosen to expand its Medicaid program, even if, like my state, it has chosen not to do so. And the deposits in the Roth health savings accounts will be phased out for higher income beneficiaries. So states selecting this option for every resident who does not have health insurance coverage through his or her employer or through public programs like Medicare or the VA or the federal health insurance, the Federal Employees Health Benefits Program. In those states, the option would be a standard health insurance plan that would include first dollar coverage through the health savings account, basic prescription drug coverage, and a high deductible health plan. States could automatically enroll their residents who are uninsured in this standard plan unless the individual opted to use his or her health savings account to purchase more comprehensive coverage or opted out of coverage altogether. I can't imagine someone making the choice of opting out altogether when they would receive this generous subsidy. In addition to federal funds, individuals and employers could make contributions to these health savings accounts, and the balances would grow tax-free. The bill also provides for a partial tax credit for very low-income individuals who do receive employer-based coverage to help these workers pay for their deductibles and their co-pays. Here's another important provision of our bill. Healthcare providers receiving payments from the Roth health savings accounts would be required to publish cash prices for their services. That would add transparency that is sorely lacking in our current system and that we need to move toward a more patient-directed healthcare future. So, for example, if you have been suggested to have a colonoscopy by your physician, you would know whether one hospital or one clinic would charge you more than another so that you could make the right decision for you. Healthcare reform should be about expanding affordable choices. And that is what our legislation aims to do by allowing states to structure their individual health insurance markets, and to do so without the burdensome individual mandate, the employer mandate, or many of the other restrictive requirements in the ACA that have substantially driven up costs and forced millions of Americans to buy coverage that is more than they want, need, or can afford. Americans should have the choice to purchase more affordable coverage if that is what works best for them. But let me again emphasize, since misinformation was given to the press about the consumer protections in our bill, the Patient Freedom Act would retain several important consumer protections, contrary to what was said earlier today by a colleague who hadn't read our bill. Dependents will be able to remain on their parents' health insurance policies until age 26. Insurance companies will still not be able to exclude coverage for pre-existing conditions or discriminate based on health status. In fact, there's no medical underwriting for the standard plan offered under the better option approach. Insurance companies cannot cap benefits by including lifetime or annual limits in their policies, and they must offer to renew policies as long as enrollees continue to pay premiums. Insurance companies must also continue to cover mental health and substance use disorder benefits for individuals, a particularly important benefit given the nationwide scope of the opioid crisis that has seriously affected my state of Maine and so many other states throughout our country, ruining the lives of individuals, their families, and their communities. Provisions like these vital consumer protections should be retained. However, the Washington-centric approach of the ACA must be changed if we are ever to truly reform our broken healthcare system. Madam President, I am pleased to see a growing consensus among members of both the Senate and the House that we must fix the Affordable Care Act and provide reforms at nearly the same time as we repeal the law. This will help protect the families who rely on the program and give insurers time to transition to a new marketplace that is based on more choices for consumers. That is what we are trying to do here. Reforms in the way we provide health insurance must ensure that individuals relying on the current system do not experience a needless and avoidable gap in coverage. If we are going to reform the system, we must begin to put specific proposals on the table for our colleagues to debate, refine, amend, and enact. And that's why the criticism is so disappointing. This is an attempt to put forth a possible solution that would appeal to members on both sides of the aisle. As we continue our work to find a responsible path to repealing and repairing the ACA, we should give the states the freedom to choose what they believe works best for their citizens, whether that means staying with the Affordable Care Act or selecting a different, in my view, a better path that will lead to patient-directed reforms that contain costs and provide more choice. The Patient Freedom Act does exactly that, and I commend my colleague, Senator Cassidy, for his leadership on this legislation, and I also want to thank our co-sponsors, including Senator Isaacson and Senator Capito, for their support as well. Thank you, Madam President.